So before I start, I just want to tell you a little bit on the anatomy of the breast. So obviously the breast is actually lying above muscle, which is called pectoral muscle. And you can see there's a lobules. And this lobule is the gland which actually will be pregnant. It will actually secrete the milk and it will go to the duct and it will actually excrete out from the nipple. So why? So that's why this breast actually is very important for the milk production. And you can see there's a lot of fatty tissue as well. And there's ligament, okay, that actually hold the breast so that you keep in shape and also can help you to have a firm breast. And you can see that multiple lymph nodes. Okay? Basically, what the lymph nodes do is they actually pass back the waste product or the fluids from the cell to over in the heart. Okay, so basically, it's part of the nutrient delivery system. Okay, because we get the nutrient, the cell and nutrient from the blood. Okay, and the rest is product, and then they go into the lymphatic system, and then go back to the heart. So we don't waste the fluids. And the waste product we get to out by using of the liver. Okay, so that's why when someone has a breast cancer, they can actually spread through the lymphatic drainage. Okay, and then they will have a enlarged lymph node. So that's why when you breast examination, you need to check over here as well. So to see if there any enlargement of the lymph nodes. Okay, so now it's a bit to the now we know that hormone change is very important for the breast. Okay, so now we want to see how the hormone that actually will affect the breast. Okay, so maybe we can start from here. So if there's no fertilization of the ovum, there's no pregnancy occur, the estrogen and the progesterone level remain very low. Okay, so there's no change in the breast. During the but however, when the estrogen and progesterone is very low, it will actually let the brain actually there's another hormone called follicular stimulating hormone, which is FSH. Okay, so when the estrogen and progesterone is very low, it will actually let the brain to secrete this hormone, and this hormone will actually stimulate the ovum to release the estrogen and progesterone. Okay, so when the estrogen and progesterone level is very high, you will inhibit the FSH. This will the brain will not secrete the hormone. So let's say during pregnancy with the fertilization occur, then the body will know, oh, progesterone is really so I don't need to get another hormone. Otherwise, you get right for fertilization and so right. Okay, so that's why when the fertilization occurs, in the brain, body, so will not stimulate another hormones. Okay. So when we see there's an increase in the estrogen, which is released by the hormone, when they actually get mature, they will start, follicle will start releasing the estrogen, and this estrogen will cause a duct expansion, or they are going to become proliferate, they are growing a bit more. So that's why they prepare for the milk secretion. Then after that, after organization, the pressure will raise because they actually produced by the ovarian cell. Okay? And this progesterone will further increase they will actually have more branches, okay, and the gland become bigger and they can produce preparation for the milk production. Okay, however, when there's no pregnancy occur, and all this time, we will actually, so that's why during this progesterone estrogen release, you will feel the breast is engorged. Okay, and sometimes you feel like a little bit pain as well. Okay, but however, engorgement is normal. It's not actually a problem. It's due to the hormone changes. And when the pregnancy occurs, so all the time you will actually go back to the normal size and it will make it shrink. Okay, so this is what every month. So there's changes in the difference, there's changes like the line of difference, and there's changes in the present. So both of these, okay, for the application and also for the reading to say or that's one of the common problems that a lady can have, which is a premature breast cancer. and is related with the premenstrual symptom. So premenstrual syndrome, the person maybe become very irritable, okay, then they will actually be a little bit stressed, or maybe some people will have a very severe pain, menstruation pains, and all, yeah. Okay, and some people even pain until cannot walk, then they can sleep, or maybe they can leave the pain. And some of them also related with fibrosis, breast changes. Okay, so in breast, we have fibrosis breast disease. You can diagnose with ultrasound. You know, this in the ultrasound, you will see multiple cysts inside the breast, and this is also related to hormone balance. Okay, because the duct that not goes back, so that the remaining duct will become cysts inside the breast, and this normally will not cause any problem. Okay, just need to monitor with the breast ultrasound. Okay. And what is the risk factor for premenstrual breast illness? Basically, the family history maybe due to genetic predisposable or maybe because of the same type of diet and lifestyle. Okay. So high fat diet will cause this breast illness or too much caffeine. Okay. So the self-care tip is we eat a low fat diet, avoid caffeine. Okay. Caffeine is present in coffee, tea, and chocolate, and try to avoid salt. Because salt, as you know, can actually cause water retention. So let's say there's more water retention, the breast need to actually contain more water, then you feel more tender. So you can actually try all these self-care tips. Self-care tips, so that you can help to relieve the breast tenderness. And exercise is very important, and you can see it's not a light intensity, it's a moderate to vigorous exercise. It helps to reduce the breast pain. And try to wear a well-fitting bra day and night to find good rest. Because if a lady have very much stress, if they don't wear a type of bra, it's so they to all this together. So the person actually will pain. And in fact, one person you have breast pain, I will advise really for you. And then after that, you also can try something reduce fat, contain fat, food. Okay, so why the high fat diet actually causes more severe pain, okay, during this premenstruation. So this is the diet I speak with, yeah. Okay, so you say that sodium concentration in pain and human hormone dependent cancer. Okay, so basically in Japan, last time don't think Japan was too much spread. Both of them take the right because they always gone. How to say, so what if we are to learn why it's why they can do so on. Okay, so more of that. Okay, so now we can see they actually started to decrease meat consumption, okay, in Japan. And all this meat is imported from US. Okay, so after that time, okay, they say that they 4 times after they actually increase the amount of meat, okay, 4 times in breast and ovarian cancer. Can increase 8 times in endometrial cancer, 10 times in prostate cancer. Okay, and we can see that more than 25% of the weight is imported from the US. Okay, so why? Because the US government, the code and the FDA of the USA, they actually approve for zero implant, okay, the US. So they can grow more meat, okay, produce more meat. Okay, so they allow this to happen. And they found that those who are for the USD, they actually contain more, okay, estrogen compared to Japanese meat. Okay, so normally for person drinking, it is not really dissolvation. Our blood serum estrogen is around 20, okay? The kilogram of the estrogen. Okay, I can see the estrogen, the meat, and I also can see the fat. And then, okay, I then guess fat. They want estrogen or the meat, they want to. What do you think? What do you think? Fat wants estrogen or the meat wants estrogen? So yeah, very good. Why? Because actually the fat also can change estrogen now. But anyway, there's more store in fat. So you can see in the big bag is 40. Okay. People have one different kind of estrogen. People one is 40 and the other one is 1 is 7. Okay, and it's not only times 11 times, okay, higher than those pregnancy. You see, the range is very low, 0.10%. Because they put the infection, that's why they don't level become very. Okay, because all the animal, they also have a list of override, this is the AX, alright. Okay, so all the animal, they actually will produce distributions. Okay, but not so much. You can see the normal weight is only 0.1, 0.7. However, when you put the implant, where to the weight, they actually gain more distribution in the animal. So let's say we keep on the hormone to your use. Yeah. So that's why you can see the meat actually so much, okay? The meat is only 3.8 and 1, okay? Compared to those who parents, meat is only 0.0 and 0.1. Obviously, I don't know the difference because I said everyone, when I saw it, I think it's very good. I'm going to give you this one, but it's beyond as a big person. Yeah. But I think relation with relation in how I think I will something that I will but I also have to how I feel about and then I'm starting to say on my house, the Rosen meeting and rest for this. And then after that, you actually on super for okay, and we are all people are consider rules on manners early, but I think rules for all this like I read the rest of the day, but behind rest is okay. And then they try to replace one serving of the local ready with one serving of three fish menu. Okay, or nuts is associated with a 50% lower risk of breast cancer overall, and 23% lower risk of female breast cancer. So that's where it means. I mean, if you eat, I'm not sure how many of you buy the test, we have expensive work. Yeah, so that's why we try to do it correctly because not only for the breast cancer, but it's also for the cholesterol. Because breast cancer is more. Okay, so that is so and so we do that with our meal records. And you can see another study, okay? They also done, okay, basically, this is not the fact about the study. Because the person level, okay, 35% of the people level, their family is strong breast cancer. Either the sister or the family sister breast cancer. Okay, so we want to see how, whether you have the genetic, whether the diet, okay, the response, okay. So they know that the same thing, okay, in age. Red meat, they will increase the risk by 23%. Okay, but if there is activity with poultry, okay, do you know that red meat is meat? But what consider red meat? Maybe pork and lemons, and whatever you like. Okay, it's very color, and I think that will also be it's very color, it's considered red meat. Then what is a meat? Chicken fish, okay. Yeah, so you know, and here is very practical. They remove the skin and buffet. Okay, so let's say you want to activate the meat, you have to be only the lean meat, not the fat, because the fat is too okay, so they will understand all the animal, actually the meat, they all contain sugar. Okay, and we contain more fat. So they can help you to reduce the risk by 80%. Obviously, here we have vision is even this so this is the different kind of design rest is. Okay, so the first one is access. What access means is that for electron comes in a long-term defense for what the well-defined feature of the breast that is into infection. Okay, so let's say you can go over breast pain during the menstrual cycle or before the menstruation, it is concerned more. Okay, but other people have one side. Okay, and then you on one side, there's also you have sense or maybe you have skin. Okay, they also play. very rare it's not only right? So if let's say not sure you still that you know that you want something and just getting if something that just okay, so I said that you want to some also kind of let's say you have the media cooperation access. Everyone is another very common disease. We basically collect virus during the rest. And this one we also on the virus. If it doesn't grow, we will grow. The thing to be that's not we talk about because of the with that we don't close over the energy like within that and classes. And by the way, no analysis is a measure of recognize and systemic favorite and then virus favorites as well. So all this nine and just need to conquer. So why we want to measure our breast cancer? Those breast cancer is a very high incidence. We can see more than 8,000 people with 2020 in Malaysia have breast cancer. And we can take mortality is also the mortality that is there with the other cancer percentage breast cancer compared to the CRP figures, you can see one actress, you can see the bar right is almost similar. So when we get standards actually then we go ahead to read the call and so so breast cancer in Malaysia, 1 in 19 women, 1 in 19 women are at risk to get breast cancer. And more than 50% of them are diagnosed before 50 years old. But however, this is good. Okay, overall virus related to whatever reasons, and above 80% or to 10 years, okay, also diagnosed the same one, 80% they can live more than 5 years, and for those patients, they can live more than 5 years, 80% of them. And however, 6 years before, the diagnosis is oral. Okay, so what is the risk factor? The risk factor will increase your age. The risk factor will increase when you are to buy your home. So I can ask me, you also have a breast cancer. She died in 2 years and when she was 28. Right, so there is any kind of that. So that's why it's very important to have side effects and reason and I mean, so that we can see and the big age is at 60 to 64 years old. It is the post-menopause of breast cancer. And the thing is, obviously, you know about, I mean, most of you maybe you heard about fractures. Because fractures is impact. It's like all this, okay, so you saw all the roles of that, but it's okay when they consider that try to go in about them. And so the breast density basically, you can see you will mammogram. Okay, so let's say mammogram now, sometimes you tell you, okay, there's a regular density. So meaning that there's a lot of tissue. Okay, so if the person will have 2 times higher risk to have breast cancer. However, if the reported as dense breast, okay, it will be 4 times more risk to get breast cancer. Okay, we'll cut down the and then we can see also basically this sorry. Okay, so let's say if a person reach your lady reach menopause early, before 12 years old, the menstrual cycle of the changes will be over, okay? And also the rate menopause, which is more than 50 years old. They are very high risk. And now we are seeing that they don't have any pregnancy. Okay, because when you give a pregnancy, 40 weeks on menstruation. So we need that there's no hormonal for weeks. So that is why we use. Okay, so the more hormone changes, more higher risk that you will get. Okay, and if you do breastfeeding also, some people like my mom breastfeeding very important. My mom doing it to give me 1.5 years. The breastfeeding for having this baby, working, managing, so on. But I think I mean, my mom is really so, my sister, and we graduated, and also, I think we have really, it's very for you to be able to do this. Okay, and another one is older age at first like our, because you know that, if your breast is continual, so when you're actually pregnant, your breast, then they are continuous to, develop. So they say that there is only a lot of pregnancy. So let's say you pregnant in the older age, there is chances that time there is chances for time there is chances for the time then wrong. Okay, so why is cancer? Because when they multiply, there is something very wrong. So they are not able to grow and grow faster and become consistent. Which is called mutation. And the hormone factors, when people who take over speed over executive, there is no risk of cancer and also to take the hormone different body, which is organ, and also very long term use one and 15 long. So currently actually the that's not take more than 10 years maximum hormone replacement therapy. So now we want to talk about Sweden. So basically, so basically, why the government they want to encourage people to mammogram, willing to mammogram, because it can detect even the small tiny dot that to detect. Okay, if you like, let's say the doctor feel the breast, actually, it's that once the feel is very hard because our hands. Even our cars are also because not everyone wants. So that's why only actually outside. So by the time you check it's already more than one seater or so it is an internal is stage two only. Okay, so that's why they encourage people to have more in order to screen and detect and the treatment of it. Because normally it actually is how to say not service. So let's say you're very strong in the industry, okay? Maybe your mom and your auntie, then you all breast cancer, so maybe you're very high risk. So for those people, they need to actually do earlier on the mammogram. And sometimes maybe you actually ask those who actually have biology, they actually do MRI. Okay, if the biology is indicated in the family, they actually need to do for 30 years, 49-year-old, and year to do MRI. Not the legal, maybe expensive, not so much. It's more needed. The government is not about it. And if you are, if let's say you don't have the ability, it's only due to the fact that only the industry, then some people need to do every year need to do that. Okay, so let's say if you don't have any risk, there's no any insurance, then you can start from 50-year-old. Then after 70-year-old, maybe one people. So that's why actually the risk, because if we want to see, for me, I think, if let's say, this exposure radiation is minimal, okay, and I have a very strong family to have people because you have high risk as breast cancer. Let's say you're very healthy and you're able to eat more conventional, you are doing exercise, and then your is very small, then you can think of whether I'm born. Okay, and another one is you can actually check by the people breast examination. Actually nowadays, I'm not sure if actually there's a breast cancer awareness study. They actually give a free breast checkup. So last time when we actually have this actually sorry, we actually call them, they actually when you see more the big man, they actually have a big man, and they can drive anyway, if not then they actually come and right. So this so the nurse actually come the lady and then they come to check the breast. And outside I come once actually and we have to and then, I don't know whether I'm going to so I actually called one lady, which yeah, the lady, I don't see why the lady was how to do the celebrate examination. But I saw the person is like, I think the science is like really false and it's really they need to be careful because very sensitive because very strong and so that's why it's very important to learn how to check on risk. Yeah. So they know the risk and so you reverse By force in English is something to be done. So you need to understand this, you need to progress the okay. So when the person is doing a diagram, they normally give you all these categories. Actually, some people understand people are different ones. So zero normally categories not mean they are not able to really understand what's happening. Because maybe there's too much biology. So the X-ray is too much color, so they can't try to what's happening. So maybe the hospital or maybe in order to it is everyone in receiving problem. Two also problems behind this computer. It is three problem probably behind. So we need to repeat one hundred 6 times. Okay? And this one is very suspicious because we may be biopsy. And this one is very suspicious of cancer. So we really need to do biopsy. And then in six category six, even more dangerous. Okay? So the bigger number, the more dangerous is. Famous design is not a rectangle. So that's why our university tell rectangle we can extend half the mirror and you can see the grass both sides. So normally the both sides should be almost equal. They always look at grass, always so you notice any changes. So there are sometimes if you have any result, you will go back to grass to get the okay. And also there might be some changes on the skin. Okay. The changes is like this orange skin. Okay, they have a lot of this kind of dimple. Okay, if you can imagine, you see an orange. There's many dimple. It can actually happen in the breast as well. Okay, so that is due to the edematous fluid because of the cancer cell already infiltrate to the skin. So you can cause this pulling effect. Okay, to the skin. And then is there any changes in the nipple? Okay, so sometimes there are people who have a reverted nipple. Okay, so meaning the nipple is going inside. So that's why the nurse actually will give you a syringe and try to suck out. Okay, because if a lady have a reverted, meaning rather than go outside, the nipple is going inside. So actually the person will not able to do breastfeeding. So that's why the nurse, they will actually give you a syringe and try to make the nipple to come out. Okay, and so that's why you have to see the nipple position and whether it's retracted. So if let's say it retracted, suddenly it become retracted, this is another symptom of breast cancer as well. Okay, and when you check the breast, then you actually feel there's a lump or there's a swelling over the armpit. Okay, or any skin changes. Okay, also is you need to check with the doctor. Okay, so breast pain is not usually a symptom of breast cancer. So how do we actually check the breast? So basically, if you are having menstruation, it's best to check 1 week after the menses. So because that time, the estrogen and progesterone level is not too high and will not cause all this breast encroachment. So let's say if you feel breast encroachment, better don't check your breast because you'll be very confused. Okay, because the lumpiness might go away after the menstruation. So you should check your breast 1 week after your period. Okay, and how do you check? You can check in standing up or lying down also can. Okay, or some people they check during shower with the shower bath. It's much more easy to check. So you need to go across the entire breast. Okay, so you can either go circular motion. Okay, so and we need to actually everyone know how to check your breast. If everyone know, then I don't need to go through. Doesn't know, okay, we just go through. So basically we use the tip of the finger because it's more sensitive. Okay, so let's say if you use other part, it's not so sensitive, not so sensitive. Okay, so when we press, we need to, your hand should be flat. Okay, not like this, but it's flat. Okay, so we will check like this, flat. Okay, so either you can go up and down. Okay, you can do like this, up and down, and it's across entire chest wall. Okay, both sides. Or you can do circular motion, start from the nipple. Okay, you can do like this. Okay, and make sure you need to check your axillary as well. Because if there's a lymph node enlarged, you can actually feel the lymph node. Okay, so if you always do it, also meaning that you have to raise your arm and you use the other hand. Okay,
the other hand. Okay, so if you always check your breast, every month you check, you will actually know your breast. So if there's any abnormality, you can detect early. Okay, so let's say if you're not sure, if there's any chance, you can actually go to the breast screening, or anytime you see a lady doctor, maybe you can ask help to help you to check and try to confirm. Okay, and but there, just now we talked about the fibrocystic changes, benign breast disease, right? Okay, for that, actually the breast will be very lumpy. So that's not easy to do cell breast examination. So that might require an ultrasound, okay, to scan. Okay, this one how to touch screen? Oh, go on already. Sorry. Okay, so basically now we are going to talk about what is the risk factor. Okay, that they will actually, what is the protective, what kind of lifestyle, nutrition, okay, activity that can prevent cancer, and what actually will increase the cancer. Okay, so basically it's a bit small. I have enlarged it on the next slide. 这个东西 yeah. Okay. So basically we want to remember green color, meaning that it's very convincing. Okay, there's a lot of study done, and there's very high. The study report is very high that we can actually believe that's true. Okay, if it's green in color, okay, all this green in color, it's possible. Okay, it can reduce the risk. And if it's orange color, it's possible increase risk. And if it's red color, there's the risk is higher. Okay, so that's why it depends on the study, because actually some of the study will tell you this good, some of the study will tell you it's bad. Okay, so for those who red in color, or most of the study telling that particular lifestyle will cause increased risk. Okay, so now we are going to see the close-up. Okay, so I think this one better a bit. Okay, so now we start from the red color, okay, that will increase risk. So the first one is for the breast post-menopause. If you drink alcohol, okay, you will increase risk, because alcohol is a carcinogen. It actually is a toxin that it can damage our cell. So unlimited, okay, so there's no low. I mean, actually they give you say that if you really need to drink, not more than 1 unit, okay, not more than 1 unit of alcohol, okay, in order to prevent breast cancer. Another one is adult body fatness. Okay, so meaning that you cannot be, that your BMI need to be normal in order to prevent breast cancer. And also the adult attended height. Okay, so when I actually read this, is very, very interesting. It seems like if you taller, more than 170 centimeter, the risk of breast cancer is higher. They say, why? Because maybe you have more nutrient. Maybe because you have more nutrients, so the cell actually grow better, then maybe your growth hormones more. Okay, so there's higher risk. But however, some people say, okay, this only happened during the Second World War. There's discrepancy on the diet, but nowadays no World War, everyone is eating well. So maybe this is not so much effect, because we can see the study done in 2017. So now it's already 2024. So that's why you can see the signs of weight change, because the lifestyle and everything change. Okay, and then we can also, next one we will see the orange color. So orange color is possible to cause the possibility to cause breast cancer. So we can see this one is greater birth weight. Okay, so let's say if the person, if the baby, when you born, okay, it's a big baby, more than like 4 kilo or more. Actually, it's more than 3.9 kilo. It's considered a greater birth weight. It's also the same, because maybe the growth hormone more, so there's more possible that it can actually increase the risk of this cell division, okay, that can actually lead to mutation. Okay, now we are going to see about this green color that possible can help you to reduce risk of cancer. So we can see physical activity, okay? If for physical activity, if it's moderate, vigorous, you can help you to prevent post-menopause cancer. If it's vigorous, you can prevent both. Okay, so the intensity of exercise is very important for breast cancer prevention. But you don't say, oh, Dr. Pua say need to do vigorous, but you never do exercise, and then you go run, what will happen to you? You might actually injure your leg, right? Or maybe your heart cannot afford. So that's why if you never do exercise, you have to start slow. Best is walking. Okay, you can see this one. If you walk very easy to maintain your weight and you will not gain weight. Okay, so it's very important if you have chance that you can actually start from walking, and later we'll talk more on the exercise. Okay, so we can see exercise is number one, okay, lifestyle that actually can help you to prevent to have cancer. Okay, and we can also, I think we go next. And if you actually give lactation, breastfeeding also very important, not only benefit the baby, okay, can get immunity and can get more better nutrition, but it also can help you to prevent you to get breast cancer as well. Okay. So this is actually a latest published, written by the staff of American Society of Nutrition. Okay, it's actually written in 2022. So they actually done this study and they found that if you eat a healthy plant-based diet meaning it's whole food plant-based, okay, minimal process, not all the mock meat or all the fried food, okay, it's very healthy. If you're able to eat all this, you can reduce the breast cancer by 14%. But however, if you eat an unhealthy plant-based diet, it's linked with a 20% higher risk of breast cancer. So that's why vegetarian is not like say you can prevent cancer if you're vegetarian, because I saw a lot of vegetarian also get breast cancer as well. So that's why it's how you eat the food, is whether it's whole food or processed food. Okay, vegetarian is not the important thing. Important thing is to increase the whole food in our diet. Okay, so we are going to talk more into the lifestyle. Okay, so this one is if you really need to drink, not more than 1 unit of alcohol. And yesterday we also talked about the soy. Okay, the soy isoflavone intake can reduce breast cancer risk, especially just now we talk about those adolescents, right? If they actually take plant-based, as example is a soy when they are young. Okay, so that's why if you have a children, don't always buy all this beef for them to eat. You can try to give them more plant-based. Because nowadays I saw a lot of children, they don't like to eat vegetable or beans. Yeah, even me myself don't like to eat beans. But however, I listen to all this health talk and I try to, okay, how many of you that, I think better I ask positive way. How many of you like to eat beans? Can you raise your hand? Bean. Not many, right? Oh, okay, quite good lah. Okay, many also. Okay, so let's say if you don't like, for me, I don't like to eat beans. And when I started to eat beans, I will feel bloated. Okay, why? Because in our guts, we have all this organism. Okay, the organism, which is the friendly bacteria, their food actually is all this fiber. So sometimes if you actually eat too much, and then this organism doesn't used to it, so you create a lot of gas in your intestine. But however, if you take a long time, more than 2 weeks, actually you feel better. So that's why please don't be disappointed if you actually feel very bloated if you actually start eating beans. Okay, so the way to reduce the bloatedness, one is you need to soak the beans and you need to make sure it's fully cooked. Another thing, actually, you can make hummus. Do you know hummus? Yeah, so you can blend it, so you can actually chop the fiber into smaller pieces so that it's more easily to digest. And sometimes I also make the black bean patty. I'm not sure you have tried before. Black bean patty is actually very nice. A way. So because all this way is to help our tongue to enjoy the beans. Okay, and slowly now I can eat beans without all this method. I can eat chickpea directly. I can eat black bean directly. Okay. And then and sometimes I want to be easy, so I cook everything together. Okay, and then I actually freeze them in a small container. So anytime when I want to cook noodles or maybe eat with rice, I just need to warm up. Okay, and then mix with vegetables also can. Okay, then I especially dal. Yeah, my friend also, my Indian friend teach me. Okay, you just actually cook, then you just freeze it, and then when you want to eat, then you just put vegetable inside and cook. Then you can actually eat them already. Okay. So another one is the radiation exposure. Radiation. Sorry. So it seems the radiation, if you expose in the younger age, is actually cause more harm compared to more elderly. Okay. So if you're obese, the relative risk of breast cancer is around 1.5 for overweight and double the risk for obese women. So let's say if you do not have an ideal body weight, do not reach the ideal body weight, if you're able to lose 4.5 kilo, okay, between 18 to 30 years old, you're able to reduce the risk of breast cancer. So that's why it's very important to maintain a good, healthy range of weight. So anyone know who knows how to calculate the BMI? Or do you know your own BMI? Do you know? Okay, that's very good if you know. So let's say if you doesn't know, oh sorry. Yeah, so this is basically how do you calculate. If you have a cell phone, you just key in your weight and then in kilo and divide it by height. Okay, divide 2 times. So let's say I'm 60 kilo, I key in 60. My height is 1.5 meter, then divide by 1.5. And then another time divide by 1.5. And then they'll give you a number. So that is your BMI. So if underweight is less than 18.5, okay, if you are 23 will be overweight. And if your obese is more than 27.5, this is the Asian criteria. For Caucasian is another one. Okay, so it will actually increase the risk of all the chronic diseases. Okay, the higher the BMI you are, the higher chance for chronic diseases, not only cancer, but also all other hypertension, high cholesterol, etc. So how the obesity can lead to cancer? The first one, okay, as we talked just now, okay, after menopause, the estrogen will be secreted by the fat. So if you have more fat cell, then you will have a high estrogen level. And this will increase the risk for endometrial cancer, ovarian cancer. Okay. And the fat cell also will increase the insulin and growth factor. Okay. Then you can actually, this growth factor will let the cell to multiply more. Okay. And the inflammation. Okay. Because all these fat cell, they actually have been stuffed. Okay, they are already too much fat inside, and they will actually increase the this inflammation in the body, and inflammation will actually lead to abnormal cell division as well. Okay. Sorry. Okay. So a lot of people actually they just try to do exercise to lose weight. Actually, exercise alone is not enough to lose weight. We have to combine with the calorie restriction. So meaning that you need to eat less, okay? Because if you eat the same thing, eat the same amount, meaning that you are not able to lose weight. So you can see if you actually have calorie restriction combined with aerobic exercise training, you can lose 5 to 15%. And we need to know what is the cause of obesity. There are many causes. It can be due to eating habit, or maybe after pregnancy that you are due to the hormone changes, you're not able to lose weight, or maybe due to the no wholesome food available, no time to prepare food, or maybe this due to stress or depression, or maybe due to other medical condition, or maybe lack of sleep, or maybe it's the genetic or family history. Basically, they say a disease run in the family, maybe it's because no one run in the family. So basically it's a lifestyle. So everyone don't run, then the problem become more fat. Then everyone like to eat fatty food, then you become more fat as well. Okay, and some medication as well, and lack of exercise. Okay, so basically, if we want to reduce weight, basically we need to have more calorie out, okay, and less calorie in. Then we can have a weight loss. Okay, so think before you eat, very important, especially for the high density calorie food. Okay, you see, actually nowadays a lot of people like to drink milkshake. Actually, I think milkshake is very unhealthy because you just keep drinking, you don't know how much calorie go inside. Okay, so basically because they are rich in sugar, they are used milk. Okay, and if you drink 1 cup of milkshake is 780 calories. So you need to jump the rope for 72 minutes. I don't think I'm able to do so long. So roughly if you, so only 10 minutes left. Okay, I need to go faster. Okay, so basically, if you run for 30 minutes, you can burn around 300 calories. Okay, so I want to show you what is 300 calories. So let's say you can see, can you finish this one? 1 kilo watermelon? Cannot, never. Okay, but you see all this, this one is quite, actually I like Indian food and it's quite healthy also. You can see this one, chapati too. Chapati actually quite healthy because it's made from atta flour. Okay, it's whole grain. Okay, but let's say idli is made from rice lah. If you can use brown, actually somebody maybe can invent how to use the brown rice to make idli, would be very good. Okay, and you can see you eat the veggie. Okay, you can actually you will feel full also with this. All this is 300 calorie. But however, you see, if you eat butter like this or you eat biscuit like this, do you feel full? No, but the calorie they go inside. Okay, and let's say the chips. I don't think anyone can eat so less chips in one time, right? Maybe it'll be double or triple, right? Okay, why? Because all this fat, sugar, and salt, they are going to stimulate our brain, okay, to let you eat more. So that's why it's very important to train yourself to eat whole food. Okay. If you want, you can try, because I tried before. So last time I love to eat cake. Last time I work in Penang, so many cakes there. So every week I go hunting. So that's why my weight is a little bit more that time. Okay. And then actually after that, I become a health promoter. So I cannot do, I mean, whatever I say, I need to practice also, right? Otherwise, no one is going to listen to me. Okay. So that's why since then, actually, I have problem with the cake craving. So what I do is I tasted the vegan cheesecake. I don't know whether non-baked cheesecake, basically made from coconut milk and also from the dates. Okay, but they don't put any sugar. Okay, so what I do is I learn how to make that one. Okay, and they put a lot of this nuts and seeds as well. Okay, so I make small cupcakes. So whenever I'm craving, I just eat, because I just make once and can eat like for maybe 8 days, 8 times. Okay, so after that, when I already 1 or 2 months, I never take any sugary food, my taste bud change. So now I couldn't take any sugary food anymore. Okay, even the beans, if you cook with sugar, I feel too sweet for me. Okay, so that's why we can train ourselves, but you need to be consistent. Okay, you need to omit them and try to replace with the whole food. Okay, so dates is one of the very good substitute for sweetener. Okay, uh, fat for fat, avocado is the best. You know, one time actually my friend they want to buy wholesale, and then we bought a lot of avocado. Every day I'm eating avocado, I feel my skin better also, because it's actually very good fat, and also they contain a lot of antioxidant. Okay, and we want to talk about exercise. How do we know that you have to listen to this talk and sing test? This is a very easy way to judge the intensity of exercise. Okay, so basically, if you're able to talk and sing when you do exercise, okay, it's very low intensity. Okay, so meaning that is not enough lah. Okay, so what we do normally is, if you never exercise, you go low intensity first, and then you add on the duration. Okay, 5 minutes, 10 minutes, 20 minutes, 30 minutes. Okay, let's say if you can walk 30 minutes, then you can jump to moderate already, meaning you walk faster, which is called brisk walking. Okay, so when you do brisk walking, you're still able to talk, but you cannot sing anymore. You have a little bit of breathlessness, and your heart rate go up a little bit. Okay, so that's why then after that, if you're able to, again, you increase the duration. Okay, 5, 10, 30, 20, 30, 1 hour. Okay, you can walk for 1 hour already. Then you go next to high intensity to run. Okay, why running is good? Because you can save time. Okay, let's say if you moderate, you need to walk 150 minutes per week. But let's say if you run just 30 minutes, okay? And then if you run even 1 minute, it's going to help you to prevent cancer. The study says so, but I didn't put it up. Okay, so that's why if you're able to do vigorous exercise, meaning that you are very fit, okay? Exercise also is very good in posture. I've seen those people who actually do exercise every day. Their posture is different from those who are not doing that. Okay, and they look very smart as well. Okay, huh? Really, I see actually one of my health guests. I am not promoting any kind of exercise, but she's actually doing Pilates. So if you see she walk, wow, very elegant. I also admire her every time. So I say I want to be like this also. Okay, but anyway, I try to do exercise, and because our posture is very important. Okay, and okay, I think this one I cover already. We just skip. Okay, and the last one, okay, want to talk about sleep. Sleep is very important as well to control our body weight. Okay, so basically we have the hormone to control our appetite. One is called leptin. Leptin is that make you feel satiety. Okay, which is produced by the fat tissue, which is called adipose tissue. Okay, and then ghrelin is actually created by the stomach and is called hungry hormone. Okay, so when the stomach is empty, they will release a lot of this ghrelin. Okay, and you send the signal to the brain, oh, I'm hungry, I need to eat. Okay, and by the time when you actually you have eaten the food, the stomach become full, they will reduce the hormone secretion. Okay, obviously when we actually started eating, I mean, some of the calorie, if you not use up, it will actually transform to fat, and the fat cell will start releasing leptin. Okay, that this leptin will make us feel full and we will feel satiety after eating. Okay, but however, if we do not have a good night's sleep, okay, we will have, if you have a good night's sleep, you will have very good leptin, okay, and very low ghrelin. So you not so feel hungry and you will feel feeling good after you eating. There are some people tell me, oh, your doctor, every time I eat, I feel hungry. I possibly didn't sleep enough, okay, because too much of ghrelin. Another possible reason is due to this high metabolism rate. Another possible reason is because your diet is very lack of fiber. So that's why it digests very fast. Okay, so the way, one way to reduce your blood sugar, blood pressure, and also your blood cholesterol is to take high fiber diet. Okay, example is beans, nuts, and seeds. Okay, and also all the vegetable and whole grain as well.